role of the nutritionist or dietitian is to be part of the multidisciplinary team and evaluate the nutritional status of the infant, and then to assess how best to meet the nutritional needs of the baby. And with that, then evaluate the need for high-calorie breast milk or formula. And from that, assess the overall adequacy of the intake. The best feeding for an infant is breast milk, if it is available and if it's the mother's choice to breastfeed. If the mother chooses not to breastfeed, there are infant formulas that can be used, but either one, breast milk or infant formula, is recommended for the first year of life by the American Academy of Pediatrics.
As a general guideline, an infant needs 150 to 175 milliliters per kilo per day of either breast milk or a standard infant formula to meet the dietary intake for both macro and micronutrients. This is equivalent to 2 to 3 ounces per pound per day.
If we feel that growth is impacted, then we would want to increase the caloric density of the breast milk or the formula.
The easiest way to increase calories in express breast milk is to add infant formula powder. The standard recipe is 1 teaspoon of standard formula added to every 3 ounces of breast milk. To increase the calories in formula, use 3 scoops of infant formula powder to 5 ounces of water, or 1 13-ounce can of concentrate to 8 ounces of water. Occasionally, an infant may need more than 24 or 25 calories per ounce. If necessary, there are a number of supplements that can be added. To determine the correct amount for each individual, it's best to arrange for a consultation with a dietitian.
When we are assessing the growth of an infant, we would want to monitor the weight, the length, and the head circumference. And we plot those on standard growth charts. And for the first 2 years of life, we want to use the WHO growth chart. If they are born prematurely, less than 37 weeks, we want to make sure we're plotting them correct at age to give them the benefit of the doubt. The standard expectation for daily weight gain for a newborn would be 30 to 35 grams per day, which translates to about a half to 1 ounce per day. If there's growth failure, we typically see weight falling first, and that's what we call acute malnutrition. If it extends longer, and then the length will be impacted, and that becomes then chronic malnutrition. And then head circumference is the last to fall off because it is doing the best to preserve brain growth.